Rob, if something's been ailing you, this next spot will help heal you and add years to your life.
Today we're stopping at Webster Orthopedic, and this is like a personal visit for me because I'm someone who hasn't taken care of a knee issue that I have. So I'm really excited to get in and talk to Dr. Roth about some of the exciting stuff he's doing here at Webster Orthopedic. Can you tell me about some of like the really groundbreaking treatments that you offer here?
Yeah, so PRP is a procedure where we take the blood out of your vein and we spin it in a centrifuge and we separate out the components. We're getting rid of the red cells and the white cells, and we're keeping behind the platelets, which we can then use as a treatment to inject in different places, whether it's a tendon or a joint. And in those cases, we're using it to either heal or to treat inflammation, pain. An MCL sprain, for example. Recently it was in the news, Steph Curry sprained his MCL. He got PRP and he was back on the court in 2 weeks. In the last couple of years, it's been shown that it can actually help a lot with arthritis as well. So we're using it in older patients, patients who've had a lot of wear and tear on their joints and their knees or their shoulders.
This facility in particular has something really unique and special. It has an urgent care that deals only in orthopedic issues.
It's a hard task for a regular urgent care or an ER to be able to do everything. They have to be able to manage chest pain, they have to be able to manage an ingrown toenail, and so we figured that why don't we just open up our own urgent care just for these exact kinds of injuries.
So I personally have a banged up knee, and part of the reason I never saw an orthopedic surgeon is because I went to a general care facility and the doctor said, oh, you're walking around, your knee is fine. So I wish I would have gone to an urgent care orthopedic specialist like this so that it would benefit from the treatments we're talking about.
Yeah, we've got Colin here today, who's a high school football player who had a pretty bad injury to his leg. So he had an emergency surgery. You see the rod right down the center of the bone. Here, this is where the fracture is all healed. So let me just take a quick look at your knee here. Obviously, your incisions all look great from your surgery. You had a pretty nasty injury, right? The bone was coming through the skin, and he's healed from his surgery great, and he's back on the football field and the soccer field, but he's continued to have pain on the front of his knee. And so we treated him about 9 months ago with a PRP injection in the patellar tendon. You had the PRP because of the pain on the front of your knee. We gave you the injection, and how quickly did you start to see some results?
It was like a day later, it didn't even hurt, so.
Does that hurt right there?
I don't limp anymore as much as I used to.
It's great to see that you're not having any pain. You got no swelling in the knee. Your knee gets fully straight, and let's just bend you up here. Looks like you're doing great.
And I do all the kicking for soccer and football. It feels good, it doesn't hurt anymore, so it's really good.
You're back on the football field now.
Yeah, I've done all the kicks for football, and I've made all of them, and like.
You haven't missed a kick?
I haven't missed one yet.
That's awesome.
So it's been good, it's been good.
He's back on the football field, kicking 50-yard field goals and kicking the ball out of the back of the end zone.
Dr. Roth, thank you so much for talking to me today. I feel inspired now to go get my knee looked at this
Come
point.
anytime.
But, thank you so much.
No problem. Thanks a lot.